Let's be real. Gynecologic infections can be confusing, a little uncomfortable to talk about, and honestly, a topic a lot of us tend to avoid. But what if understanding them was way simpler than you think? Today, we're going to demystify these super common issues by looking at your body's own amazing, carefully balanced ecosystem. We're starting from the inside out.
So, here's the million-dollar question, right? Is it a yeast infection or is it bacterial vaginosis? It's one of the most common points of confusion out there, and you know what? Getting the answer right is pretty crucial for feeling better fast. So stick with us, and by the end of this, you are going to know exactly how to tell the difference.
All right, first things first. To really get what goes wrong, we have to appreciate what normal actually looks like. And here's a spoiler. The goal isn't to be sterile down there. Nope. It's to host a thriving, perfectly balanced community of tiny microorganisms.
Now get this, it's pretty mind-blowing. For every one bacterium in there that uses oxygen, there are 10 that don't. These are called anaerobic bacteria, and they love low-oxygen environments. We're not talking about a small colony here. This is a bustling metropolis of bacteria. And that 10-to-1 ratio is so important because the vast majority of these little guys are working with your body to keep you healthy.
This whole community has a name, the normal vaginal flora. And here's why that matters. It's your body's first line of defense. Seriously, think of it like a living protective shield, a whole microenvironment created by helpful bacteria that have this awesome mutually beneficial relationship with you.
So the secret weapon for this whole defense system, it comes down to a number, a pH between 4.0 and 4.5. Now, to give you some perspective, that's about as acidic as tomato juice. And this acidity isn't just some random fact. It's the ecosystem superpower. It creates an environment that is actively hostile to any harmful invaders trying to set up shop.
So, how is that perfect acidity maintained? Well, think of it like a well-tended garden. The good bacteria, lactobacillus, are like the friendly gardeners. They feed on something called glycogen, which is a nutrient your own cells provide. And in return for the meal, they produce lactic acid. And it's that acid that keeps the soil, your vaginal environment, perfectly balanced and fiercely protective. But what happens when that carefully tended garden gets, thrown out of whack? This is where the most common issues pop up, not from some outside invader, but from a power shift happening right inside. And boom, here is the answer to our big opening question. With bacterial vaginosis, or BV, some of those anaerobic bacteria I mentioned start to grow out of control. This actually raises the pH, making it less acidic, and that's what causes that characteristic fishy odor. A yeast infection, on the other hand, is a fungal overgrowth. And here's the key difference. With yeast, the pH often stays totally normal, but the main symptom is that intense itching and irritation. See? Two very different problems with very different signs.
Under a microscope, the telltale sign of BV is a clue cell. I love this description from way back in 1955 because it just paints the perfect picture. Imagine a normal cell with a nice, clean border. Now, picture that same cell so covered in bacteria that its edges look all fuzzy and stippled. That's a clue cell. It's basically the smoking gun for BV.
So what can throw this whole system off? Well, a bunch of things can disrupt the garden. Broad-spectrum antibiotics, they can be like a wildfire, wiping out the good gardeners right along with the bad bacteria. Douching can literally wash away that protective acidic layer. And even things like hormonal shifts, smoking, or having an IUD can sometimes tip the scales and disrupt that delicate balance.
Okay, so we've covered imbalances from within. But what about infections caused by pathogens that are introduced from the outside? Well, this brings us to a whole different category: sexually transmitted infections, or STIs.
Right. So one really distinct and important group of STIs are the ones that cause ulcers. Let's take a closer look at the most common one. Genital herpes, or HSV, is the #1 cause of genital ulcers. It's a chronic viral infection, which means that once you have it, the virus stays in your body. And here is why that's so important to understand. It can be transmitted even when a person has no visible sores or any symptoms at all. This is called asymptomatic shedding, and it's a huge reason the virus is so widespread.
The typical life cycle of a herpes lesion follows a pretty clear pattern. First, it starts as a little blister, which is called a vesicle. Then, that blister breaks, creating a painful ulcer. And finally, the ulcer crusts over and starts to heal. Knowing this progression is a really key part of recognizing an outbreak. All right, let's clear up another common point of confusion: urinary tract infections, or UTIs. While the symptoms can sometimes feel like they're in the same neighborhood, a UTI is a completely different problem happening in a completely different system.
So a UTI is an infection of your urinary system, usually the bladder, caused by bacteria like E. coli traveling up the urethra. Its classic symptoms are that awful pain when you pee and feeling like you have to go all the time. Vaginitis, on the other hand, involves the vagina and vulva, with symptoms centered around discharge, odor, and itching. Different location, different cause, totally different problem.
So we've covered a lot of ground, from the internal ecosystem to external invaders. Let's pull this all together into some clear, actionable takeaways that are going to empower you with knowledge.
Look, trying to self-diagnose can be really tricky, and getting it wrong can just delay you from feeling better. So when should you absolutely see a healthcare professional? If it's your first time with these symptoms, if over-the-counter stuff isn't working, if the infections just keep coming back, or if your symptoms are severe, like you have a fever. And of course, always get checked if you think you've been exposed to an STI or if you're pregnant and have symptoms.
And that brings us to this super important reminder. Our goal here is to educate and empower you with information, but this is never, ever a substitute for real medical advice from a professional. Please, always talk to a healthcare provider to get an accurate diagnosis and a treatment plan that's right for you.
We'll end on this thought. You know, symptoms aren't just an annoyance. They're signals. They are your body's way of communicating that something in its incredibly delicate ecosystem is off balance. Understanding those signals is the first, most powerful step you can take toward being in charge of your health. So the real question is, are you listening?